Hello, everyone. I am Ivan, a social worker with 10 years of experience in sex therapy services. I am sharing a case today about erectile dysfunction and the reasons behind it. The case involves Mr. Wong, and here is the message he sent when seeking help.
Ivan, hello. I have been experiencing erectile dysfunction for 3 years. I had a previous episode of impotence, but it improved with some rest and self-pleasure. However, during intimacy with a new girlfriend, I experienced a sudden loss of erection right before penetration. At that moment, she blamed me, asking why it wasn't working and why I couldn't get hard. This incident has deeply affected me, and I often feel frustrated and panicked whenever I recall it. Despite trying various solutions such as exercise, abstaining from masturbation, traditional Chinese medicine for kidney health, and even Viagra, my condition has worsened. I've tested with a different girlfriend, but the problem persists, and I struggle to get aroused even during foreplay. I feel immense pressure related to sex, and the fear associated with it sometimes causes insomnia. I'm at a loss. Could this be a psychological issue? Ivan, what could be wrong with my body?
Mr. Wong attributes his erectile dysfunction to a past failed experience, leading to anxiety and panic. If the partner doesn't understand, it may result in blame and further exacerbate the issue. Many times, women don't understand. Throughout a man's life, he will experience erectile dysfunction at least once. Some people may have no issues in sex after facing erectile dysfunction, but others may spiral into anxiety. This case is evidently rooted in a past failure, causing him anxiety about sexual encounters. This sexual anxiety and panic play a significant role. During the next sexual encounter, this anxiety aggressively suppresses his parasympathetic nervous system, leading to erectile dysfunction. So, despite Mr. Wong's efforts with exercise, abstaining from masturbation, traditional Chinese medicine, and Western medication, the problem persists. I often say, engaging in sexual activity is like driving a car. The car's performance represents bodily functions, and Mr. Wong's body functions well. The car is well maintained. Desire for sex is the accelerator. We want to drive, to have sex. Anxiety is the brake. Medications and other aids are like fuel additives, improving the vehicle's performance. Even with plenty of additives, using Viagra, traditional Chinese medicine, exercising, and maintaining the vehicle well, if the inner sexual anxiety persists, pressing the brake, sexual anxiety, and accelerator, desire for sex, simultaneously will lead to a stall or engine failure. This case highlights that anxiety is a significant obstacle in erectile function. Our therapy aims to help Mr. Wong alleviate sexual anxiety. First, we educate him on how erectile function operates, reducing his panic. Simultaneously, we use hypnosis techniques to take him back to the environment where his girlfriend hurt him. Afterward, we guide his present self to comfort his past self, repairing the emotional trauma. When this deep-seated anxiety is resolved, the fear of sex naturally diminishes. Subsequently, with gradual practice and psychological therapy, erectile function can be restored to normal. Finally, Mr. Wong can successfully marry and enjoy a happy sex life. I hope today's information helps men. Goodbye.